Joining me on our next edition of Startup Report is another member of the Tampa Bay Wave Tech Diversity Accelerator cohort, Dr. Albert Huang. Welcome, sir.
Hi, thanks for having me.
Sure. And your company is called Allotrope.
That's correct.
Very cool name.
Oh, thanks.
And so let's dig in. I mean, it's something I think we're going to have to really understand what we're dealing with here in muscle stimulation during surgery. So give us a brief overview of what you've brought to market or what you're bringing to market.
Yeah, thanks, Joe. It's always interesting talking about it because the time that our technology is used on folks such as yourself or other people that might be listening or watching, it's actually when you're asleep, right? So if all goes well, you would have never known that our technology was being used in the operating room. What we do is we provide the surgeon a capability of identifying different structures and different organs and tissues during surgery using, like you had said, electrical stimulation. What we can think about is like our whole body's connected and controlled by nerves, which really are sending little jolts of electricity through our body to move our mouths, move our hands, help us swallow. And in one of our technology focuses is moving urine from the kidney down to the bladder. So it's not really glamorous, but if you would think about all these other organs that sit in your lower belly, in your pelvis, female reproductive organs, the colon, urinary system structures are really close to it. And it's actually like the number one concern that surgeons have is accidental injury, right? We don't want that for our patients. We're trying to help them do the best thing. We're going in to solve a problem, not to create a new one. So I wanted to create a technology where myself as a surgeon, I was seeing that need, right? I would get to a point in a dissection where I'm pretty sure it's one of these two structures is the one that I don't want to cut, but it's not always obvious. Everything's a little bit bloody, a little bit red, a little bit pink. So if I could take that guesswork out and through my existing instruments, send a little zap as if your body was moving these structures, I can tell what is what by how it moves really quickly and easily. And so that's what we've done. We've created an electrical signal that mimics the body's own electrical impulses that make structures such as the urinary system move so that when you're operating, I take that guesswork out. And in a matter of seconds, I can tell you, this is that, and you know what to cut and what not to cut and move on with your case safely for the patient.
So are the signals, the actual electrical impulse itself, is it pretty consistent no matter where you're operating, or do you have to vary the type or, I guess, severity of the electrical pulse based on where you're using it?
Yeah, that's actually where a lot of our R&D went to for the last few years in the beginning stages of the company is figuring out what that signal looks like, right? So our signal is actually now tuned so that it works in every person. And what it does is that it works specifically for smooth muscle structures. These are ones that are found in your urinary system and in your intestinal system. It's a different kind of muscle than skeletal muscle, which is the things that you can control voluntarily. We figured out how to mimic the body's involuntary muscular controls.
Got it. And so what does that actually look like if you are, if you're looking down into the, the operating area, the incision, and you see these two different areas and you apply the electrical impulse? So how do you see the difference in the result?
Yeah, what we see is kind of what harkens back all the way back to medical school. So we just see, let's say, for example, the structure of the ureter, we actually see it move like a worm. It actually contracts and wiggles as it moves urine from the kidney to the bladder. And it's a very characteristic movement, and nothing else in the body moves like that. So from day one, you as a medical student are trained to almost look for that visually. And that's kind of the standard of care right now is you're trained to look for it, but you have to guess as to where it is or start dissecting to try to find that movement. Whereas now we can give that movement on demand. So that's what it looks like. It's a pretty simple system because it takes very little training to understand how to use it as a surgeon, because we're leveraging your existing training, your existing understanding of human anatomy, and just building on that, right? I wanted to create something really simple and easy to use, but provides clinical value without tons of equipment, hours of training, and potentially complicating an already complicated operation.
So when you do something like this that makes a process easier and it sort of fits into a flow, how were you able to determine the value, or when you decided to price it, how did you go about trying to articulate the value when selling?
Yeah, I think a lot of it is as a physician myself, and identifying this from my own personal experiences, when I talk to other doctors about it, I approach them as colleagues, right? I say, hey, nobody wants to talk about difficulties in operations, right? We're all supposed to be infallible as physicians, or at least come across that way. But the goal is to say, hey, like this will make it safer for you, safer for the patient, and move things along while maintaining your autonomy. You don't need to call a colleague to help you find the structure in the middle of the case. What is that value to you? There's a number of big companies that have put products on the market that are pretty complicated to help identify structures like this, but they require you placing pieces of plastic into the patient. They cost over $1,000. So we knew we had a dollar price point that we wanted to come way under. And so we were able to create a technology that we are projecting a price point of $100 a case, which in the field of surgery is a rounding error. And then essentially democratize it because the surgeons use their own tools. So we're saying, hey, it's $100, so you don't even have to think about it, about adding like really a huge burden of financial costs to the case. And then there's no waste, there's nothing you need to place. You just send a stimulation, and it gives you all the same value that you're looking for, and that's resonated well.
Got it. So then it becomes a pay-per-use, you don't have to buy any kind of equipment or whatever. It's just a straight pay-per-use.
Exactly. Yeah. The common phrase, at least in the startup world, is like the razor blade business model, right? So, we place the box, which is a very thin form factor, in the operating room at no cost to the hospital. And then they pay for what amounts to a subscription card. So a recharge card that gives you a certain number of uses. And that's all they pay for. And it kind of keeps it elegant as well, and also helps keep the costs low.
And are you looking to work with insurance companies to get that coded so that they can take that cost off, or is it small enough that it just doesn't move the needle enough that you have to worry about that on a case by case basis?
Yeah, that's a great question. I think that's the I don't know what they call like $1 million, $1 billion question potentially for us. All the existing technologies also don't have codes, right? And the hospital's been kind of sort of willing to eat that $1,000+ cost per case because of the value that it adds. So our first way to tackle it is, let's not get insurance involved just yet, but say we come in at 1/10 of the cost, right? You're willing to spend the other one. Now you can use it for all your cases and still provide that value. As we roll out to market, which will happen later on this year, which we're excited about, is we'll start looking at how those cases come out, right? Do we start affecting patient outcomes, changing length of stay, any other metric that we can look at? If we can collect that data, then that's something we can go to insurance companies and say, hey, here's something beyond, risk mitigation or helping the surgeon move forward the case in a confident manner. Here's some hard numbers that you're really interested in as they convert to dollar values that we can maybe work something out together.
Got it. And with such an affordable, obviously the aggregate of the revenue can add up, but at that price point, are you able to utilize a traditional medical sales model where you can have sales staff and there's enough money to go around for them in the company?
Yeah, as of right now, it looks like yes. We do a lot of financial modeling. We've brought on folks that used to be at big medical device companies that have run their medical device sales in a similar space as ours. The nice thing is that our technology is used in over 7 million operations done each year around the world. It's a step in every operation that you do in that lower belly and in your pelvis. So hysterectomies, colon resections, things that our loved ones at some point will probably undergo, you'll need to have the surgeon identify that structure. So the volume is there. And then for me, this is my first startup, right? I'm a physician. I went down this path in life to help people. For me, it's like if I can provide something that is low cost, still helps everybody, and still provides enough value as a company to be able to hire people and allow them to have a livable salary. That's really what I'm looking for.
Right. So coming through med school, you're used to a grueling environment, but now that you've made it, how have you found startup life? Is it back to the grind again, or how's it been for you thus far?
Yeah, now that we're a little bit over 4 years in, it's just as much of a grind. I think if we add up the hours, startup life is probably more, just because there's no work-life separation. It's a work-life blend at this point. I'm definitely happy that I've traded the pager and running into the hospital at 4 a.m. for just staying up until 4 a.m. writing emails and things like that. It's just a different life. It's definitely a lot harder. I feel like in many ways there's a lot more at stake because it's not just the patient's life on the table, which is certainly like high stress and high pressure, but now it's just a more complicated world, right? You have to think about wearing all these different hats instead of just focus on patient care. You think about the business aspect, relationship building, fundraising, R&D, and all these other components. But I really like it. I definitely wouldn't have it any other way, I think. So
And I would assume that, there's just from a straight, self-identity standpoint, you work so hard to get to this place where, being a surgeon is a pretty top, of that specific mountain is right at the top. And, to go back and start a plan and like you said, have to deal with all the vendors and little things and ask
yeah.
people for money and sort of how was that mental transition for you?
It wasn't bad. I guess I never like took a step back and thought about it from that perspective. In the end, for me, like the goal has always been the same, right? For me, life is like we have, as far as we know, like one go around on this earth. So what do I want to do with that, right? As long as I can always provide for my family, put food on the table, keep a roof over our head, and kind of pull my weight, then let's do something where I can potentially, even in a small way with the technology that I create in my mind, influence and benefit people that I'll maybe never see, touch, or feel like I would as a surgeon, right? I can only operate on one person at a time as a physician, no matter how good you are. But if you can create a technology that empowers other physicians, then, like you were saying, that's almost, you have to be careful how you say it. It's almost another level above
Right.
just being a surgeon, right? Not to make it diminutive, but you're like, now you're giving them new capabilities and new technologies they never had. And I think that's a really powerful thing to even just to strive for, right? I think so few people are willing to take that risk. I said, why not me?
Yeah, and if you can, that's time is very finite, obviously, and moving from a one to one to a one to few to a one to many, that's sort of the mindset now is that you can improve many lives with one person, versus a one to one ratio. Um, so, talk about Tampa Bay Wave. How did you come to find out about the accelerator, and what were you hoping to gain from joining it?
So, kind of my knowledge of all the innovation that's happening in Tampa, culminating in Tampa Bay Wave, and the program that Allotrope is in right now is so Dr. Richard Manassi and I are friends. We go back almost at the beginning of my company. We actually met in Houston when he was kind of leading a startup during his foray into the space, and we had been in touch ever since. The awesome work that he had been doing, and he would update me every time that we would meet in the Bay Area and we're doing fundraising or having meetings. He would always talk about the stuff that was happening in Tampa. And I actually myself grew up just north of Daytona Beach, so I'm a Floridian in many ways as well, but on the Atlantic coast. But the what was interesting is that as he would update me on what was happening, what was being developed, and the networks and connections that he would have, I'm always looking for expansions and ways to benefit the company, right? And so when this opportunity for the accelerator came around, he let me know about it. He told me about the mentor network, the hospital systems, the people that he has built and brought in personally that are involved in medical device sales and distribution. Like being able to pull all that together, like certainly if I could do the legwork, and I have in the past, to go and find these individuals myself, that can be done. But if you go to one kind of one-stop shop and they're all there and they're all mentors and they're all ready to help you, like why would you not, right? So it's been a great opportunity. We're not even halfway through at this point. Really excited already with the people that we've met, and then looking forward, hopefully, if the virus lets up, meeting more of these people in person in the coming months.
So, as a physician, you were used to running your shop. You had your staff, you had your team, and so talk about how your philosophy changed, or what you looked to do when you built your team for the business.
I think there's a lot of parallels, but there's also kind of the way that I even looked at it as a surgeon, right? It's like a lot of the time, the classical view of a surgeon in the operating room is not just as a conductor, but it's almost like dictatorial, right? It's like you're the last word, you tell everybody to do. The surgeon yells at people and throws instruments if they don't get their way. Like I've never been that kind of person, right? I realize everybody in the operating room as staff, as the even down to the
And
medical.
now you've given them an electrical shock device to even
Yeah,
take.
exactly. Like if you don't do it right, you get a cattle prod, right? But really, it was more. It was like, okay, I'm the conductor, but I'm not the end all be all, right? They're like, if I'm the conductor, I'm not the one that should be playing the violin, or I'm not the one that should be playing the drums. There's people that have dedicated their whole lives to that skill set, and I just need to find the best person to fill that role, right? That's my job, and I'm here to steer that ship and provide the high level guidance. And yes, I'm the face of the company, and I do a lot of the outreach, the fostering relationships with big medical device companies, the pitching on stage, things like that. But it's really all those other people that make it work, right? And so I just carried that thought process and approach through to the company, and just said, look, I definitely don't have all the answers. I've never taken a medical device to market before. I continue learning all the nuances of it every day and the various things that are both good and bad and ugly. But the goal is to have people that have done it before on your side, or know the key things to do when you reach a certain stage, and then just bring those people in. And like somebody else that says, like, just get out of their way, like let them do what they do, because that's what you brought them on for.
Sure. So you said you're about 4 years in, and you got the product rollout here in the next couple of months coming up. Congratulations on that.
Thanks.
If you could go back, and tell yourself 4 years earlier a few things, what was there anything that sticks out in your mind as something you would do differently? Had you had the chance to start over?
Yeah, I think about that a lot, right? Because hindsight's always 2020, and when you look backwards, you're like, well, my original device looked like this, and now it looks like this, and it's way different. And I had no idea it was going to look like this if you asked me that 2 years ago, 3 years ago. I'd probably just, but everything's an evolution, right? And like I learned so many things along the way that has gotten us to where we are. I don't think I would change anything more so than probably just go back and tell my, few years younger self that the road's a little bit longer than you would think it would be. I go back and look at my old presentation decks, and I laugh because I write things on there like, oh, on market 2018 or on market 2019, and I was like, well, now we're well into 2020, and now we're finally truly there. I think I knew going into it that it was. Everybody always said it's a marathon, not a sprint. But yeah, to really take that to heart now is one of the biggest things that I've learned. So
Right. And a lot of things people, uh, you know, talk about potentially changing. There's specific actions they took or whatever, but a lot of it is sort of mindset change. It's they're at a point now where they just have an understanding. They're used to speaking to investors, used to speaking to the medical devices, and they realized that was just sort of a mental breakthrough. It wasn't that anything drastically changed in their life other than just gaining that comfort. And and so looking back at that, are there do you feel that? Did you feel that sort of evolution happen where things that were looking at it from the coming up to it side versus looking back on it were quite different and a lot less dramatic than they might have seen coming into it?
yeah, I think the biggest thing is the outward facing components of running a company, right? Like really having to be comfortable being on a gigantic stage by yourself, nothing else around you, not even a podium to kind of feel like it was protecting you. Standing out there in the open, truly exposed, or needing to go to people you don't know and striking up conversations. I realized, not many people like inherently love doing that or feel comfortable doing that. And I certainly didn't. So I knew that was a skill set that I needed to kind of hone, almost like working out, right? It's like a muscle. The more you do it, the more comfortable you get doing it and the easier it gets. And then it becomes natural, or at least outwardly feels natural. Now, that's something that I recognized very early on I needed to kind of work on and kind of keep building. Like I used to hate networking hour when it was like interest groups and meetings. I was like, I don't want to talk to people I don't know. But then you realize like that's actually a critical aspect of getting your technology out there, socializing it, finding the people and the talent that you're trying to recruit. All that kind of is part and parcel. So I think that's the biggest skill set I feel like I've gained in the midst of all this stuff. And it's not really tangible, and most people don't recognize it. They just think that you're a really outgoing person. But yeah, it's like it actually took some work. So
And do you do that with the mindset? I guess what I'm wondering is what role do you think luck plays in making the right connections and getting the right customers? And when you go out and put yourself out there, uh, do you get a sense that you're sort of just trying to increase your chances to get lucky? It's kind of this the two ways of saying the same thing. And the more people you expose yourself to, but how much do you think just right place, right time, and right mood from the right listener plays into to the success of a startup?
yeah, I think if anybody tells you that luck didn't factor into their success, at least in some form or another, is lying to you, right? I mean, obviously the hard work is a critical role of it, and a good idea obviously is a foundation of it. But luck and timing, both controllable and out of your control, I think play huge roles in all this. I mean, I would say there are times that I probably don't even realize that stars aligned and the right time came around, right? So everything from how I met my chief operating officer, the only other full-time person on my company, was he had left the senior role at his startup that he had led for like 8 years or more, and just happened to be at a networking event in Colorado, where I do not live. And a woman struck up a conversation with him that was an alumni of one of my board members' companies, and was like, "Oh yeah, hey, I was just talking to my colleague, and you know, she's part of another startup, and they're looking for like an engineer. You should talk to them." And it was that led me to this guy that I now have worked with for 3 years, and we're going to take it all the way through to completion together, and we work really well together. So, you know, um, it was that moment of luck and things aligning that made him available to work with me, and then recognizing that kind of lucky moment, and kind of leveraging it and pushing the company forward with his help is where you take that luck and turn into the hard work component. So, and then, hey, there's definitely plenty of times where, the company is running quite low on cash, and for whatever reason, some investor decides that now's the time that they're ready to put a bunch of money in, right? It wasn't 6 months earlier, it's not 6 months later, having me right then. And it was timely.
It's funny. That's something that I always ran into after, I went through so many and early in businesses that I've started, being stressed about cycles of cash flow and whatnot. And
Yeah.
after about 3, 4 times where it just seems to work out, you don't know why, maybe you cut something, maybe someone came in the door, client and an investor, whatever. You do learn to just sort of trust the process a little bit. And, I think a part of it's just there's an elasticity in what you're able to tolerate.
Exactly.
And, and maybe if you stretch a little bit longer and go a little bit leaner, then that investor comes in and you don't realize you're doing it because you're stressed the whole time. Then, but, and I think the other piece is, like you said, with that person becoming available, your COO, is recognizing the opportunity. And that's the part where, I love, a lot of times where I always struggled to delegate was I felt like if I sent somebody else to do it, they would do it. But so many beautiful things that would come out of coming to do it, and 7 other things that come out of that, right?
Right.
Opportunity. And so,
Yeah.
always not wanting to pass up the chance to, talk to the person and interact with them because you didn't know, if the conversation was supposed to be about A, that they end up being your COO, right? So,
Right. Exactly. Oh, exactly. I mean, it's fascinating. And I may be paraphrasing it, but it's like the phrase, it's like, the chance favors a prepared mind, or luck favors a prepared mind. Like you said, it's like there's a lucky component, but you need to be smart to recognize that is a lucky moment and take advantage of it, right? So,
and it's kind of half the fun because that's what I call it.
Yeah.
I call it treasure hunting. You're treasure hunting
like
for
that.
opportunity, and yeah, we all want. I think we're all innately treasure hunters, as hunter gatherer or whatever. Great. Well, sounds like things are going well. Good luck with the product launch.
Thank you so much.
If we do an in-person demo day, I look forward to meeting you in person at Wave.
Yeah, fingers crossed. I really hope that it happens. I was talking to Richard about it. I was like, there's just, although we're all kind of getting used to the Zoom meeting life and world, there is something that you miss about being there in person, that actual physical human interaction, right? In person, I think it makes a lot of difference. You can't network via Zoom. I feel like you can't really have like serious conversations this way. There's still this virtual wall. So yeah, I told him, I was like, I really hope at the very least, come demo day in a couple months, that things will be a little rosier around the U.S. that we can do this in person.
Or you may just consider moving to Tampa Bay permanently because it's a place.
Oh yeah, I mean, if we I may be able to convince my wife. I mean, she's been to Daytona. She thought it was okay. I mean, it's a kind of a
West Coast a little bit different.
yeah, West Coast is a little bit different. So, but I also just want to go to Burns Steakhouse too. So I'm a big wine drinker and collector. So it's like that's like a global mecca that if I go there for demo day, I'm definitely having dinner there at least once, maybe twice. We'll see.
All right. Well, I appreciate your time. And,
yeah, thanks, Joe.
We'll keep on keeping on.
Absolutely. It was a pleasure. Thanks so much again. All right.